Welcome to this session on rapid airway assessment in emergency medicine. In the next slides, we will explore how to quickly identify airway threats, assess patients, and prepare for safe management. Let's get started. Importance of rapid airway assessment. Airway compromise can become life-threatening within minutes. Rapid assessment allows healthcare providers to recognize problems early, intervene promptly, and reduce complications or mortality. Understanding its importance is critical in any emergency setting. Airway anatomy overview. Understanding airway anatomy is essential for rapid assessment. The upper airway includes the nose, mouth, pharynx, and larynx, while the lower airway includes the trachea and bronchi. Key landmarks like the epiglottis and vocal cords guide airway management and intubation. Signs of airway obstruction. Recognizing airway obstruction early is critical. Key signs include stridor, snoring, gurgling sounds, use of accessory muscles, cyanosis, and altered consciousness. Identifying these signs quickly allows for timely intervention. Airway assessment overview, ABCDE. Airway assessment is part of the primary survey using the ABCDE approach. A stands for airway with cervical spine protection, B for breathing, C for circulation, D for disability, and E for exposure. This systematic approach ensures no critical step is missed in an emergency. Assessing consciousness and airway reflexes. Assessing consciousness and airway reflexes is essential. Use the AVPU or GCS scale to evaluate responsiveness and check cough, gag, and swallowing reflexes. Patients who are unconscious or have absent reflexes are at high risk for airway compromise. Airway history questions. A thorough airway history helps predict difficulties. Ask about prior intubation challenges, obstructive sleep apnea, facial trauma, or limited neck mobility. This information guides preparation and reduces the risk of complications. Mouth opening assessment, Mallampati score. The Mallampati score assesses mouth opening and visibility of airway structures. Class 1 indicates a low risk, while classes 3 and 4 suggest a potentially difficult airway. This simple bedside test helps anticipate intubation challenges. Thyromental distance assessment. Thyromental distance is a key predictor of difficult intubation. It is measured from the chin to the thyroid notch. A distance less than 6 centimeters suggests limited space for laryngoscopy and a higher risk of airway difficulty. Jaw protrusion test, upper lip bite test. The jaw protrusion or upper lip bite test evaluates mandibular mobility. Patients who can easily bite the upper lip have a lower risk of difficult laryngoscopy, while inability to do so indicates limited jaw movement and a higher likelihood of airway difficulty. Assessment of teeth and dentition is essential before airway intervention. Loose or broken teeth, dentures, and prominent incisors increase the risk of dental injury and may obstruct laryngoscopy. Identifying these issues early helps prevent complications during airway management. Facial trauma assessment. Facial trauma can rapidly compromise the airway. Swelling, fractures, burns, or bleeding may distort anatomy and make airway management difficult. Early recognition is essential, as these patients may require alternative airway strategies. Foreign body airway obstruction. Foreign body obstruction is a common and potentially fatal airway emergency. Patients may present with choking, inability to speak, gurgling sounds, or sudden respiratory distress. Rapid recognition and immediate intervention are critical to prevent hypoxia and cardiac arrest. Airway assessment in trauma patients. In trauma patients, airway assessment must always include cervical spine protection. Manual inline stabilization is essential while evaluating and securing the airway. Rapid assessment and early control of the airway can be life-saving in severe trauma. Airway assessment in medical emergencies. Medical emergencies can rapidly compromise the airway. Anaphylaxis causes acute airway edema, burns lead to progressive swelling, and infections such as epiglottitis may obstruct the airway unexpectedly. Early recognition and proactive airway assessment are essential to prevent sudden deterioration. Pediatric airway considerations. Pediatric patients have unique airway anatomy. A relatively large tongue, small mandible, and narrow airway make them more prone to obstruction and rapid desaturation. Always perform an age-specific airway assessment and prepare appropriately. Geriatric airway considerations. Geriatric patients present special airway challenges. Reduced neck mobility can make intubation difficult, dental issues increase the risk of injury, and underlying comorbidities may complicate airway management. Careful assessment and planning are essential. Predictors of difficult bag mask ventilation. Certain factors predict difficulty with bag mask ventilation. Beards, obesity, missing teeth, older age, and a history of snoring can make ventilation challenging. Identifying these predictors early allows proper preparation and prevents hypoxia during airway management. Predictors of difficult intubation. Several factors can predict a difficult intubation. A Mallampati score of 3 or 4, a thyromental distance less than 6 centimeters, limited neck extension, and small mouth opening all increase the likelihood of challenging laryngoscopy. Early identification helps in planning the safest airway approach. Rapid Airway Assessment Checklist. A rapid airway assessment checklist ensures no step is missed. Review the patient's history, perform a thorough physical exam, identify predictors of difficulty, and prepare all necessary equipment with a backup plan. This systematic approach improves safety and outcomes. Airway Adjuncts Overview. Airway adjuncts are essential tools for maintaining airway patency. The oropharyngeal airway is used in unconscious patients, the nasopharyngeal airway in semi-conscious patients, and supraglottic airway devices provide an alternative when intubation is difficult or delayed. Pre-oxygenation and oxygenation assessment. Before any intubation, it is essential to assess oxygenation and pre-oxygenate the patient. Monitor SpO2 and respiratory effort, and provide 100% oxygen via mask or nasal cannula to extend safe apnea time during airway management. Equipment preparation for airway management. Proper equipment preparation is critical before airway management. Ensure laryngoscopes, endotracheal tubes of appropriate sizes, bag mask devices, suction, and backup airway tools are ready. Being fully prepared improves success and patient safety. Positioning the patient for airway assessment. Patient positioning is essential for successful airway management. The head should be in the sniffing position, with neck flexed and head extended, aligning the oral, pharyngeal, and laryngeal axes. Pillows or ramping may be used to optimize alignment, especially in obese patients. Rapid airway assessment in emergency settings. In emergency settings, rapid airway assessment must be efficient yet thorough. Quickly evaluate facial trauma, swelling, and secretions, assess consciousness and reflexes, predict difficulty using Mallampati score, jaw, neck, and teeth, and ensure equipment and backup plans are ready for immediate intervention. Airway assessment documentation. Documenting airway assessment is essential for patient safety. Record the history, physical findings, predictors of difficulty, and planned interventions. Clear communication with the team ensures everyone is prepared for safe airway management. In summary of rapid airway assessment steps. In summary, rapid airway assessment involves evaluating consciousness and airway patency, examining mouth, jaw, neck, teeth, and Mallampati score, identifying predictors of difficulty, preparing equipment with a backup plan, and continuously reassessing the patient to ensure safe airway management. Thank you for watching. Don't forget to subscribe, like, and leave a comment for more educational medical content. Join us on Dr. Abdulgnee Qutina Medical Channel to stay updated with the latest in emergency medicine and ICU care.